Hi, my name is Atiqa and I am from Group 23. I will be talking about caring for a patient with TPN, and TPN stands for Total Parenteral Nutrition. Firstly, starting with assessment, prior to administration, we have to obtain a complete health history, including allergies, drug history, and possible drug interactions. A complete physical examination also must be obtained and assess for presence or history of nutritional deficits such as inadequate oral intake, GI disease, and increased metabolic need. Also, obtain the following lab studies, which are total protein or albumin levels, creatinine or blood urea nitrogen, BUN, CBC electrolytes, lipid profile, and serum iron levels. Next is planning, which is we plan the client's goals and expected outcomes. So the client will be expected to exhibit improvement or stabilization of nutritional status, be free of infection or injury related to TPN, demonstrate an understanding of the drug's action by accurately describing drug side effects and precautions, and also immediately report side effects such as symptoms of hypoglycemia or hyperglycemia, fever, chills, cough or malaise. Next are interventions and rationales. Firstly, monitor vital signs and observing for signs of infection such as elevated temperature. This is because bacteria may grow in high glucose and high protein solutions. Next is to use strict aseptic technique with IV tubing, dressing changes, and TPN solution, and refrigerate solution until 30 minutes before using. Infusion site is at high risk for development of infection. We also have to monitor blood glucose levels, observe for signs of hyperglycemia or hypoglycemia, and administer insulin as directed. Blood glucose levels may be affected if TPN is turned off, if the rate is reduced, or if excess levels of insulin are added to the solution. Also, we have to monitor for signs of fluid overload, as TPN is a hypertonic solution and it can create intravascular shifting of extracellular fluid. Renal status must also be monitored. Intake and output ratio, daily weight, laboratory studies such as serum creatinine and BUN are used to assess renal function. And lastly, to maintain accurate infusion rate with infusion pump, make rate changes gradually, and never discontinue TPN abruptly. This is because abrupt discontinuation may cause hypoglycemia, and a sudden change in flow rate can cause fluctuations in blood glucose levels. In client education or discharge planning, we have to instruct client to report fever, chills, soreness, or drainage of the infusion site, cough, or malaise. Instruct client that infusion site has high risk for infection development, hence sterile dressings and aseptic technique with solutions and tubing are needed. Also, we have to instruct client to report symptoms of hyperglycemia, high blood sugar, which are excessive thirst, copious urination, and insatiable hunger. For hypoglycemia are nervousness, irritability, and dizziness. Next is to instruct client to report shortness of breath, heart palpitations, swelling, or decreased urine output. As for number 5, we have to instruct client to weigh themselves daily, monitor intake and output, report sudden increases in weight or decreased urine output. That's why we have to make sure they weigh themselves daily, and keep all appointments for follow-up care and lab testing. We also have to instruct them about the importance of maintaining the prescribed rate of infusion and never to stop the TPN solution abruptly unless instructed by the healthcare provider. And for the last part is the evaluation of outcome criteria. Evaluate the effectiveness of drug therapy by confirming that client goals and expected outcomes have been met. For example, the client demonstrates improved nutritional status, The client is free of infection or injury related to TPN, and the client also demonstrates an understanding of the drug's action by accurately describing drug side effects and precautions. And last but not least, the client verbalizes the importance of immediately reporting side effects such as symptoms of hypoglycemia, hyperglycemia, fever, chills, cough, or malaise.